I am Brittany Silva, and later in this YouTube video, I'll be starring as the insurance customer.
I'm Brandon Cannon. I'll be the insurance agent.
I would like to thank you for listening to this presentation about universal healthcare. To begin, universal healthcare is a need in the United States. However, there are issues in achieving this and allowing every U.S. citizen to afford healthcare.
Give you a couple of quick examples. If you look at a hospital bill, you might see an IV bag charge. It's an IV like this, about $280 just for the IV bag. That might strike people as very high. A stapler. This is a stapler that's often used in surgery. Something like this costs about $1,200. This is a chest tube. If someone has compression of one of their lungs, they might need a chest tube like this. That costs about $1,100. And you'll find examples like that really all over a room like this. Suture, something that's used in just about every operating room in the world. This type of suture over here costs about $200. And if you look at even devices like, this is a needle that's used for biopsy. So if there's a concern that someone has a tumor, they would use a needle like this, and this is going to cost about $800. Now it's important to keep in mind, if you ask the manufacturers of a device like this, why so much money? They'll say, well, it took years to develop something like this. The research and development costs are significant. Also, they're guaranteeing a certain level of effectiveness of this needle. That costs money as well. But something maybe you didn't know, when you look at a hospital bill, it's not just the cost of the supplies. There's also administrative costs that are built in. There's the cost of covering people who simply don't have insurance or can't pay. That's built into these costs as well. And finally, keep in mind that what is charged and what is ultimately paid are two very different numbers. In fact, to build on that, if you talk to some of the executives of these hospitals, they'll say for every dollar that is actually billed, they may collect just pennies. They also tell us they do hike up prices so that patients with good insurance can help pay extra to compensate for those payers who pay less, uninsured altogether perhaps. You know, Nancy, we talk a lot about these bills, and you say that you can help negotiate the price of these bills down. What do you tell people? I mean, they're going to watch that and think, well, that's ridiculous. What do you say when someone calls you?
So what we tell them first and foremost is to get a copy of the entire bill and to look for redundancies. If you're seeing redundancies in services, go back and meet with your medical professional. Determine, did you indeed have 2 MRIs during the course of 1 week? Did you indeed have 4 different blood transfusions? You and your family may only recall 1 or 2. Try to understand where the redundancies are. Sit down and look at hospital bills through the perspective of, are any of these services that I don't understand what they are? And for the large majority of people that we help, they often don't understand what many of the charges are. So you want to take a look at that and find out what it is. You also want to engage the billing representatives and the financial representatives of the hospital in that discussion and have them understand, I need an explanation of these charges.
Can you actually get a hold of those people?
It's very difficult, and often you will have to make an appointment. And we will say it's important that you request the appointment, not only through a telephone call, but if you have an email address.
The point of this presentation is finding and creating a solution for healthcare to be affordable for everyone in the United States. The history of universal healthcare began in the early 1800s. In Germany, in the early 1800s, they created the sickness insurance. Sickness insurance was created due to the need to stabilize citizens' income by protecting them against the loss of wages from sickness rather than having to pay medical expenses. From that point on, the topic of universal healthcare spread throughout Europe in places such as Scotland, France, and Denmark. Then in 1965, Medicare and Medicaid was created in the United States. Medicare is defined as the federal health insurance program for people who are 65 years or older. Certain younger people with disabilities and people with end-stage renal disease are also included in the Medicare program. Medicaid is the largest source of funding for medical and health-related services for people with low income in the United States. Ellen Grayson stated that 45,000 people die per year because they're unable to afford health care. We would like to solve this issue in allowing every U.S. citizen to afford health care. Brandon will describe more in detail our proposal for this solution.
Hello everyone, here's a little bit of background on our proposed plan. Our plan, as Brittany mentioned, is to create a bill that will be passed through Congress and placed into effect. The purpose of the bill is to eliminate the prevention of selling insurance across state lines. In November of 2012, the Republican Party drew up a bill to present to Congress, but it was stalled by the Democratic Party. The current Affordable Care Act has been decreasing in popularity since it's been enacted. For our three alternatives, we decided to choose, the first being equal tax treatment between out-of-pocket and employer-purchased health care. The second option is to change Medicare from a reimbursement service to a defined benefits plan. And the third option is to open borders between states for insurance companies, increasing the supply and decreasing the cost of health insurance. In order to gain the equal tax treatment between out-of-pocket and employer-purchased health care, there are two options. Either make the health care benefits provided through employers taxable, or making the payments of out-of-pocket health care expenses and the purchase of personal health insurance fully tax deductible. With our changing Medicare from reimbursement service to defined benefit plans, Medicare recipients would receive specific amounts each year. Funds not used can be rolled over for the following year. This will also increase freedom of choice for Medicare recipients. Our open borders plan will not only break up government-protected oligopolies, but it will increase competition within the health insurance industry. It will expand options available to consumers and will allow more personal plans. We used three methods to determine the most feasible plan. We used interviews, surveys, questionnaires, and academic reports. We are going to conduct interviews with insurance company representatives and highly respected economists. We will conduct surveys and questionnaires on members of the upper class, middle class, and lower class from all regions across the United States. We will use qualitative data for academic journals and reports to determine the best solution. The cost for open borders is there's government involvement, companies will have to downsize in order to compete, and companies that cannot downsize are forced into bankruptcy. However, the benefits for open borders are lower cost of health insurance, higher competition among insurance companies, and the removal of oligopoly within the states. The cost for the equal tax treatment plan is that there will be taxes on the benefits of the healthcare plans purchased through employers, and that this plan will have little value to taxpayers with low incomes. However, the benefits are that there will be an equal incentive to purchase either out-of-pocket or through an employer. For the plan of changing Medicare from a reimbursement service to a defined benefit plans, the cost are there is limited funds, and once the funds are used up, the remaining expenses are out of pocket. The benefits for this are all excess funds can be rolled over for use in following years. Howdy, ma'am.
Howdy.
Welcome to eHealth. How can I help you?
I'm just new to the area. Moved from Georgia to Alabama.
Alright.
I'm looking for an affordable healthcare insurance.
Alright, well, we got some of the best things in town here, thanks to the new law that opens up state borders. We got some specific for Alabama that cover anything from alligator attacks to floods to hurricane, all that. Or you can reach out to something from Iowa if you like, if you don't care about the hurricanes and whatnot, just simple basic plans. Just give you a little information around Alabama. Average hospital costs about $1,300. With the Alabama plan, you're only going to be paying about $400 of that yourself, out of pocket. Anything over that, it'll be covered. Alright,
Thank you for the form detail.
no problem. Got any
Don't
other
mind me.
questions?
I have one more question.
Yeah, no problem.
Actually, two questions. Do you want to use sunflower seeds?
Nah, I'm good, man. I'm good.
Oh, they're delicious. Do you have a handout you would be able to give me?
Oh, right here, ma'am. I got one right here for you. It's got all our basic plans on there. It's got a couple of neighboring states from Louisiana and Mississippi on there as well. They got some stuff. Not as good as ours, of course, but we give you that option now.
Once again, I'd like to thank you so much for listening to this presentation. In conclusion, I'd like to ask you, does our recommendable plan sound like a good option for the United States? To recap, our recommendable plan is to open borders between states, increasing supply and decreasing cost. Another question is, what can you do to influence and involve yourself in the healthcare movement? You could talk to your senators and representatives of Congress to get your opinion heard. And you could also partake in the survey for our study, which will be having a survey for each region in the United States to get a representative sample of the citizens of the United States. We look forward to working with you and hearing about your opinion in the near future. Again, thank you so much for listening to this presentation.